In this video, we will show you some of the more advanced functions of B-mode imaging, particularly around Doppler. For the purpose of this video, we will be focusing on the carotid artery. Firstly, just to draw your attention to the various presets that you can change depending on what vascular structure you may be interested in. As is touched upon more thoroughly in our instruction video for basic functions of wireless ultrasound probe, you can optimize your imaging for your purpose or preference. You can do this by adjusting the time gain compensation and focus accordingly. We will now talk you through power Doppler imaging, which is the PDI function, which is looking at the amplitude and strength rather than the direction of a signal. We can change the gain with the corresponding buttons and also change the steer direction with its corresponding button. There are other filtering techniques you can change, which may be touched upon later in this video. Now let's return to our B mode. We are just going to look at the vessel in transverse direction and go on to color Doppler. So here you are getting directional flow, which by convention would make red for arterial flowing towards our probe. You can see here we have a nice illustration of the Doppler flow within the carotid artery towards our probe. You can see a number of functions regarding how we can manipulate this. As before, you have the steer function and gain setting, which can be changed. We can also use the move function to move the window of interest. This can be done either by manually pressing the screen or by using the move button at the bottom right. The other function we are interested in is analysis of the velocity signal. This can be done by going into pulsed wave, or PW as it is shown on the screen. So here we now have the pulsed wave function demonstrating the velocity signal on the bottom half of the screen. You can adjust the baseline scale to suit the velocity profile you are looking at, as well as the steer, volume, which would typically be a third of the vessel diameter you would select, and the angle to optimize your flow calculation. Gain can also be adjusted. We can now also freeze the image in order to take measurements, typically looking at peak and end diastolic velocity. This saved the images as a video cine loop. Here, we are freezing the image for velocity measurements at peak and end diastolic values. The values are given on the upper right part of the screen. We are now demonstrating a playback loop of the last few frames. So that was a quick run through of the Doppler functions included in the wireless ultrasound probes from Balliter Medical.